Good afternoon, everyone. Today is Thursday, July 17th, 2025. I'm Dr. Umonja Smalls, Director of Professional Development with the Developmental Disabilities Administration. We want to welcome you to today's community meeting. If you would like to use closed captioning so that you can read what is being said, click this button. Sometimes the transcription is not exact, but it's pretty close. All attendees are in listen-only mode, and your mic and camera are currently turned off. Today's presentation is available in the handout section. Click here where you see the paperclip to download it. If you have a question that you'd like us to read and answer, click here where you see the question mark to add your question. If you would like to ask your question aloud during our comments portion of today's presentation, please click the hand icon. Then we will invite you to unmute yourself and ask your question during the comment period. Please limit your question to one so that others will have the opportunity to ask theirs as well. And now, before beginning our meeting, we also want to ensure civility. The free expression of diverse viewpoints is an essential value for our group. This freedom comes with the responsibility to engage respectfully, which involves treating one another with dignity and with respect in good faith. Uncivil behavior, disruptive conduct, abusive language, threats, or harassment will not be tolerated and may lead to being excused from the meeting. Thank you for helping to keep this meeting productive and comfortable for everyone. And now I'd like to turn this meeting over to our Deputy Secretary, Marlena Hutchinson. Good afternoon, Marlena.
Good afternoon, and thank you, Dr. Small. Welcome, and thank you to everyone for joining us today. Really want to thank the honorable members from the Governor's Office, the honorable members from the legislature, participants, parents, family members, providers, and community partners for joining us today. We have a pretty lengthy agenda, as you can see. We will be talking about administration updates, some LTSS Maryland updates, the waiver amendment. We're going to provide some updates there, and then open up the mics for questions and answers. So again, welcome, and thank you for joining us today. Next slide, please. Next slide. So for administration updates, we are very, very excited to provide some information in regard to some staffing updates to the DDA leadership team. Next slide, please. First, Allison Wall. She will be serving as DDA's Chief of Staff. Ms. Wall comes to DDA with over 9 years of service and experience in supporting the intellectual and developmental disabilities community. She just recently worked at the U.S. Department of Health and Human Services, Administration for Community Living. We are very excited to have Allison join us. Next slide. Isabella Guyot is DDA's new legislative liaison. Bella joins DDA as a health policy analyst, and her role will focus on supporting legislative coordination and reporting. Bella brings a decade of experience with policy and legislation to DDA, including 8 years of work with the federal government and the National Archives and Record Administration, the House of Representatives, and the Government Accountability Office. DDA is very excited about Bella joining us. She started on July 9th. Next slide, please. Next, Nova Evans. Nova is now the Director of Programs. She brings over 20 years of experience in the health and human services field with a primary focus on supporting individuals with intellectual and developmental disabilities. Most recently, Nova served as the Deputy Director of Federal Programs and oversaw critical Medicaid and waiver initiatives. We're really excited that Nova is stepping into this new role as the Director of Programs. Next slide, please. Next is Janet Berman. Janet is our new Deputy Director of Programs. Janet has over 40 years of experience in the field of disabilities, intellectual and developmental disabilities, with a primary focus on supporting individuals with IDD across the lifespan, including parents with disabilities. Janet's been working with DDA and served in various capacities, many pivotal roles since 2010, and we are very excited that Janet has stepped up into this leadership role as Deputy Director for Programs. Next slide, please. Next is Megan Hall. Megan is DDA's new LTSS Maryland Program Manager. Megan brings about nearly a decade of work working with the intellectual and developmental disabilities community. Megan started at DDA at our Southern Maryland Regional Office, where she acted as the LTSS Maryland liaison for almost 3 years. During this time, she was very involved with provider transitions from PCIS2 to LTSS Maryland and troubleshooting LTSS Maryland issues, both in a provider portal and with person-centered plans. We are really excited about Megan stepping up into this new leadership role. Next slide, please. Next is Miss Rachel White. Rachel has over 4 decades of progressive management and experience across the Maryland Developmental Disabilities Administration's service delivery system. Her background spans direct support, case management, nonprofit leadership, and governmental roles, while also providing valuable insights for collaborating with diverse stakeholders. As you all may know, Rachel was the Eastern Shore Regional Office's Deputy Director, and we are very thankful for Rachel stepping up into the leadership role as Director of the Eastern Shore Regional Office. Next slide. We also want to talk about some important updates in regard to some team members at the regional office in Southern as well as Central. Starting on July 3rd, 2025, we have hired a new person-centered plan reviewer at the Southern Maryland Regional Office, Alexandra Vimpany. Also at the Central Maryland Regional Office, also starting on July 23rd, 2025, we're welcoming Regina McCoy. Next slide. Now I'll turn it over to Robert to talk about program sustainability for the Developmental Disabilities Administration. Robert?
Thank you, Deputy Secretary Hutchinson. My name is Robert White. I'm the Chief Operating Officer for the Developmental Disabilities Administration. We're very excited to announce the launch of the Program Sustainability Group in August 2025. The entire Maryland intellectual and developmental disabilities community will have an opportunity to volunteer to be part of this work group, including people who are currently receiving DDA services, people who may not be receiving our services, key external stakeholder groups, and just as importantly, people who are currently on one of DDA's waiting lists. More information, including the application process, will be forthcoming. We're also excited to announce that this year, one of our strategic imperatives is improving and enhancing how we engage with all of you. As such, we will be sending out a survey next month to gather your feedback regarding how well we are doing. This survey will serve as the baseline and will inform our action plan to improve upon this baseline in alignment with Deputy Secretary Hutchinson's vision. Now I would like to turn it over to Nicholas Quinones for some important LTSS Maryland updates. Nick?
Good afternoon, everybody. If we can go to the next slide. One more slide, please. So we've got some exciting LTSS Maryland enhancements that I'm going to talk to you about. So the first one is one that actually went out this past weekend. We did some updates to our DDA eligibility letters. So the DDA made modifications to all of the DDA eligibility letters in LTSS Maryland These modifications were to implement some more plain language and to take out attachments that did not apply to certain letters, just to streamline the communication to the individuals receiving these letters. Some of our upcoming work that we'll be releasing over the next couple of months within LTSS Maryland. The first one is there's an upcoming enhancement that's going to give our DDA regional office staff the ability to deny person-centered plans that are in a status other than in progress, approved, denied, or discarded. This enhancement will ensure that a timely decision is being made on all person-centered plans. The update is also going to include an enhancement that's going to allow our DDA regional office staff to end date services in auto-extended person-centered plans. Again, the idea behind this project is to create efficiency in decision-making within the person-centered planning process. The next update that we're working on is related to our provider portal system and billing. So we are doing an update to the LTSS provider portal in order to allow providers the ability to create or upload billing entries in order to rebill or resubmit services that were previously voided, discarded, or not authorized. Now, this would typically happen for these billing entries in circumstances where they were previously voided for reasons like ineligibility, or there was a PCP correction that needed to be made. So now when they go to rebill these, they will no longer be classified as duplicate services, which will allow our providers to be paid via the provider portal. The next enhancement that we're working on is there's an upcoming enhancement that will enable DDA regional office staff to modify the effective and end dates on turning overnight supports on and off. This update will ensure that providers receive the correct rate for the services that they deliver in the event that overnight supports were incorrectly switched on or off in the past. And then next slide, please. And then finally, the last enhancement that we're working on right now is related to our day-to-day administrative support service. So there's an upcoming enhancement to DDA person-centered plans that will give participants in self-directed services the option to request day-to-day administrative support services as a standalone service, rather than bundling this in with their individual and family-directed goods and services. This update is necessary for DDA to be in compliance with the Budget Reconciliation and Finance Act of 2025. More updates on this service are going to be forthcoming in the next couple of months. And that's it. I'll hand it back over to you, Robert.
Thank you. I would now like to hand it over to Nova Evans, our Director of Programs, to give an update on the waiver community operation. Nova?
Great, thank you. So as you know, the Maryland Department of Health has submitted amendments for the DDA-operated Medicaid waiver programs to the Centers for Medicare and Medicaid Services on July 17th, 2025. We really want to say that we truly appreciate all the stakeholder engagements and input on the development and revisions of the initial proposals. All stakeholder input is critical to the process of improving services in Maryland and is deeply valued. DDA will continue to engage stakeholders for input on future waiver amendments. So as you can see on this slide, through the process, DDA received 307 emails to our dedicated email box. We received comments from 255 unique stakeholders, and we also received feedback from the Waiver Advisory Council and other stakeholder groups. We have gone through and reviewed every single individual comment, and we are working on a summary document that we will share on the dedicated webpage, along with the other resources that I'll mention in a few slides. Next slide, please. Again, the submission date for the waiver amendment is July 17th. The next steps are that we submitted it, the Center for Medicare and Medicaid Services reviews and has follow-up questions, and we go back and forth with them on the waiver. We're going to be providing information and training to stakeholders through the amendment process. As you can see, I already talked about on the last slide, the public comment period did end on July 13th. And the effective date of the amendment will be October 6, 2025. Next slide, please. So here you can see a number of waiver amendment resources with the links to them. So the first one is the dedicated webpage for the Community Pathways Waiver Amendment Proposal. And you can find all the different appendices with our proposed changes on there. And we will be adding the changes post-public comment on there as well. You'll also find the DDA operated Medicaid waiver amendment frequently asked questions. Additionally, there is the Center for Medicare and Medicaid Service Instructions, Technical Guide and Review Criteria. And there's also the revisions to the Home and Community-Based Services Waiver Application and Technical Guide presentation. Next slide, please. And here you'll find the links to all our webinars that we've held, and along with the presentations, and you can click on those links to find them. They are also on our YouTube page. And now I will hand it over back to the Deputy Secretary, Marlena Hutchinson.
Thank you, Nova, and thank you for the presentation. At this time, can we move to the next slide? I believe this time we have available for public comment. So Dr. Smalls, if you could please.
Okay, so we are going to enable hand raising. So if anyone has a question they'd like to ask aloud, they're going to be able to raise their hand and we will unmute you, but we will go through some of the questions that were placed in our question box first. Okay, one of our questions is, will the rate change to the geographic differential? Will the rate change to the geographic differential rate take effect on October 6th with the waiver amendments?
Sorry, I was on mute. Yes, that is correct.
Okay. The next question is, would you please give us a time frame where we can get the summary document?
Yes, we are working on getting that all together and uploading it. We should have it on the website next week, and we'll also send out communication letting all stakeholders know that those items are on the website.
Okay. There was a request for contact information for the new administrative updates. Thank you for that request. Okay. What is being done to fix the glitch in LTSS preventing the DDA from reviewing waiver applications, leaving participants in limbo?
So can the requester of that question please expound?
And while they're providing some additional feedback on that question, I'll go to the next. Were there any changes made as a result of the comments that were provided to the waiver amendments?
Yes, we did make quite a few changes. Again, you will find those in the documents that we post online, as well as the public summary document. There were changes that weren't accepted with this amendment, but we did that so we could have further stakeholder engagement and really make sure we get the best outcome for the next amendment or future amendments.
Thank you. How long can a plan be in an auto extend?
That timeline varies depending on when the plan has gone into auto extend and as the participant and their team members are working with the regional offices and the CCS, the coordinators of community services. So that timeline actually has variability based on the unique circumstance.
Thanks, Deputy Secretary. Many participants have been requesting access to their LTSS account, but they have not received it.
The department is still actively working with its contractors on the My LTSS portal for participants, and additional information will be forthcoming in that regard.
Thank you. Allowing regional office to deny PCPs that are still with the CCS and end date services on auto extend PCPs, providing the ability to resubmit non-EVV services. Okay, I'm sorry, it didn't end with a question. It's more of a comment. Does the DDA have plans to expand capacity at the 2 state institutions in preparation for future changes in the program waiver?
Dr. Smalls, could you repeat that question, please?
I'm going to have to come back to it, but I'll go to the next question. I'll come back to that one. What's with, okay. Can you give some additional information about the Arc of Chesapeake Now Fellow? Why the name change? What happened?
The ARC's business relationship can be further explained or better explained by Fellow, formerly the ARC Central Chesapeake Region. So we would advise for that information to come from Fellow itself.
Thank you. Please elaborate on this. Allowing regional office to deny PCPs that are still with the CCS and end date services on auto extend. It's not clear.
Marlena, did you want me to take that one?
Yes, please.
Sure. So with the ability for regional offices to decision plans, the idea is, let's say a person-centered plan was submitted up to the region and they had to send a clarification request to the CCS. And let's say that clarification request has been outstanding for, I'll exaggerate here, several weeks or several months. We don't want the plans to get stuck, right? So right now, the regional offices have no capability to do anything with PCPs that are stuck with the CCS. So this is going to provide them the ability to decision those plans rather than having to wait for them to come back to them.
Thank you, Nick. And it's also very important to note that the regional office will not be making arbitrary decisions on those plans that are stuck. They will work very closely with the CCS in that process.
Correct. And then the second part of that question about the ability to end date services in an auto extend plan, again, this would not be used arbitrarily, right? The idea here is, let's say a person's person-centered plan goes into auto extend, and during that auto extend period, there is no longer a need for one of the services or multiple of the services. This is a way to end specific services without having to cut off the entire plan. So for example, let's say there are 5 services that an individual is receiving in their auto extended plan, but one of those services is no longer needed. It's providing them the ability to end date it so that providers cannot keep billing against the service that's not being delivered.
Thank you. Can you please give an example of a plan being denied in auto extend?
So that would not be a thing. So just to clarify, um, those are two separate things, right? So you can't deny a plan that's in auto extend. You can only end date services within it. They can deny the plans that have not been decisioned yet. And those are the ones that would be in that clarification request status.
Thank you. What if the CCS isn't communicating or quits? What protection is there for the participant?
Dr. Smalls, can you repeat that question, please?
Yes, what happens if the CCS quits? What protection is there for the participant?
Each coordination of community services agency has staff and staffing requirements that are monitored by the department. So if a participant CCS quits, the CCS agency would work with the family to identify another CCS to work with the family and the participant.
Thank you. Will providers be notified when these end dates are being processed?
The providers will receive notification by way of the person-centered plan and the individual CCS, as is the current process.
Why are some services being removed on auto extend plans?
Services should not be removed on auto extend plans. We are aware of there being a challenge in that regard, and we are working with our vendors. In the interim, the department has implemented a workaround to restore those services that should remain throughout the decisioning process.
Is there an update on transitioning youth and their waivers? Many TYs are waiting to start meaningful day services.
Youth who are transitioning into one of the DDA operated Medicaid waiver programs will continue to work with their CCS and the Maryland Medicaid Administration, as well as the Developmental Disabilities Administration. Those updates will happen and come from the CCS, and in addition to the any updates from the DDA or Medicaid. So those updates in regard to a person's eligibility status comes directly through their CCS, as the CCS is working with their Maryland Medicaid Administration and the DDA.
Sorry, I'm going through some of the questions. There's a few repeat questions. Okay, a lot of these questions are repeats. Here's another one. Could Nick please expand on the retroactive removal add over overnight supports by the regions? What would constitute a change?
I would actually probably need a DDA business staff member to speak towards that.
Hi, this is Robert. Yes, thank you for that question. Dr. Smalls, can we flag the sender of that question so that we can have their respective region get back to them on that, please?
Yes, I certainly will. Thanks for your patience. I'm just going through the questions, and there's a lot of really good focused questions on CCSs and supports needed from them. Want to make sure that you know that we're reading through every single one of those and we'll be responding accordingly. Someone asked, who does our chief of staff report to? Allison Wool. Who does she report to?
Ms. Wall will be reporting to the Deputy Secretary, so the Deputy Secretary for DDA, myself, Marlena Hutchinson.
Okay, do we want to take a few minutes to go through some of the questions or the folks that have raised their hand to ask live questions now?
Yes, please, Dr. Smalls.
Okay, and then we can go back if we have some additional questions in the chat box. Okay, our first person is coming, the first question is going to be coming from Dominique Clark.
Hello. I just wanted to verify because I didn't hear an exact time that would be allotted for the auto extend plans. And so I just wanted to confirm. I understand that it will be on a case by case basis, but is there something more concrete you could give us providers? Because if it is closed out, then we won't get paid anymore. So it's such a high stakes concern to be in the know about and start to plan for.
Are you asking in regard to when that LTSS Maryland enhancement will go into effect?
That is another question I have, but I'm asking just a full confirmation, or you're saying that it will depend, but I guess what are the factors in which it will depend on? Like if the CCS hasn't answered you in 30 days, if if 3 months have passed since the annual date, something more specific, or is it just always going to vary from reviewer to reviewer?
So again, with that, there is variability because the department's goal is to make certain that the individual gets the services and supports that they need to, maintain safety in the community. So as the department is working with the CCS and as the family is working with the CCS, The CCS will be the linchpin in communication to the participant and the family for when the final decision is made on the plan, which is the case now.
Okay, and when will it go into effect, the ability?
Nick, when is the enhancement scheduled to go live, please? Again?
For the ability to end date services within the PCP, auto extend?
Auto
Yeah.
extend.
Yes, that is a part of our August release. I believe it's August 9th.
Okay, so August. And then Nick or Marlena, the other category, what is that anything important for providers to know, or is that just between you and the CCS, or what is the purpose of the other category?
When you say the other category, you mean the ability we're giving regional offices to deny a plan that's stuck in clarification request?
Okay, so just in your slide that you did, you said there would be an other category and also an ability to end service. So I guess that's the same area.
Yeah,
Okay.
correct.
Okay, so our next question, can you share the purpose of the program sustainability group?
Yes, the purpose of the program sustainability group is for us to come together to talk about short-term and long-term program sustainability. As you know, um, without the MGA and the governor's office stepping in to take action, the DDA would have had a significant shortfall in its budget. And though there has been some restoration to our budget, it the restoration didn't go to the extent of providing everything that we need. So we're going to have to continue, as we've committed to doing during the budget hearings, with working with all of you to figure this out together. This is we're all in this together, and we're going to need everyone at the table to figure out how we sustain our programs, not just in the short term, but in the long term, not just for the folks who are currently receiving services, but also for those folks who are waiting to get into DDA services. So that's the purpose of the program sustainability work group.
Thank you. Our next question is coming from Vanessa Ridgway.
Hi, I'm sorry, I couldn't get unmuted. Thank you for taking my question. I'm an overwhelmed parent, and my son has, I hope you guys can bear with me because I've bared with you all for a long time. My son's plan was submitted, and approved back in 2024. It has been stuck in EDD department. His caseworker has tried unsuccessfully multiple times to get the status, and I need help because my son he wasn't eligible for list because his name was in this system, and it just is causing him to not be eligible for, list services because we've signed up for the waiver. We've been approved, and his application and his status has been stuck with the EDD department. I had an appeal on our list decision. The hearing officer herself tried to find a person in the EDD department to no avail. So who can help us?
Thank you, Ms. Ridgway, for sharing your experience with us. I will personally speak with my colleague, Mr. Moran. He is the Deputy Secretary for Medicaid, as well as Mr. Warren Waters Harvey, who is the director of the Office of Eligibility Services. Please know that the DDA, as well as the Medicaid administration, we work very closely together on these eligibility and enrollment concerns. And so when these cases are brought to the department's attention, Deputy Secretary Moran and I make certain to follow up with our teams to get some action with these challenges. So I have taken your name down, and I will make certain that your son's case is one that is highlighted for Deputy Secretary Moran's attention. And I really apologize for your experience.
Thank you. Our next question is coming from Ray Arshed.
Hi, everyone. Thank you so much for all of the useful information and perspective. I had a couple of questions. The first one was, how can agencies get more involved in community events? And is there a newsletter that we can sign up to that kind of lets us know what's going on every month? Forgive me if there is. I am a bit new to this. And is there a contact person on your end that we can send, say, announcements or press releases or any kind of event that we're doing, that sort of thing, like a PR liaison? And the second question is, there is something called MAND training. I'll be going on it on Monday. Uh, is it mandatory? And if so, can the agencies apply for reimbursement? It costs a bit. It's about $3,000 for a couple of years of uh, certification. So those are my questions. Thank you.
So, Dr. Smalls, would you
Sure.
like to share? Thank you.
In regards to the newsletter, we have a listserv where Ray, we will make sure that you get a link so that you will be subscribed to our newsletter. It goes out on a monthly basis. And we really want to continue to collect great stories, success stories from organizations, from families, from participants, from people, stakeholders that highlight the experiences of people with intellectual and developmental disabilities. So we will make sure that that's shared with you. And we do also, just because it's one of the things that we're going to be talking about quite a bit, there's opportunity for you to give feedback, just like you've given now, that perhaps you want to be able to give some additional information that we can include in our newsletter. So stay tuned for that. We want to make sure that we're hearing from you and getting feedback from those of you who are engaging and reading that newsletter. So thank you for that. We'll make sure that you get added to the listserv.
And I can speak to I think the other questions if I can remember them correctly. I think just to piggyback on what Dr. Smalls was saying, also reach out to your regional office to provide information, to get information about other community events and other opportunities. I think that's a really great way to work with them. The other question you had about MANT training, it is required for certain services. And if people have a restrictive behavior support plan, then there are requirements around it. We have on our website a training matrix. If you go to the support for providers page, it'll show you our training matrix, which will kind of outline all the trainings that providers are required to have, including MANT. The department does not reimburse for MANT training at this point. I will say also that during the waiver amendment process, we did get a lot of questions about training and some recommendations. So we will be engaging with stakeholders in the future on looking at the required trainings for the different providers and direct support professionals in the field. But for now, it is only required for certain services, and we do not reimburse.
Thanks, Nova. Our next question comes from Elizabeth LaFrance.
Hello. My question is on the wage changes in November 2024 with the self-direction manual. There were new rates, new reasonable and customary wages, announced. And then in July 1, there were additional changes to reasonable and customary rates. I caught a quick something about a deferral until the waiver was approved. Could you explain, because a lot of my clients have already experienced, wage reductions according to what came out in November and in July. Could you just what is deferred, what's not deferred for the GeoDiff changes? Thank you.
Sure, the cost saving items that are deferred until October 6th are the geographical differential for the provider managed model, the reduction of the dedicated hours funding percentage from 86% to 87%, and the implementation of the or reinstatement of the cap on IFDGS services and breaking out the day-to-day administrator from that category.
Thank you. The next question comes from Sherry Dexter.
Hi, thank you so much. I appreciate it. My question is about the waiver. I wanted to find out, my understanding with the process with CMS is that if they have clarifications, that stops the clock as far as when it could be actually implemented. I also understand that there may be times that they have a backlog of waivers from other states that they're looking at, which also could delay timing and getting a response from them. So I wanted to find out, A, how does that affect the effective date for the waiver amendment that you're submitting? And then second, is there going to be a red line version that will be available to us to review what changes you actually made in regards to what you originally put out? Thank you.
So I can answer that. Thank you, Sherry. When a waiver is submitted to CMS, CMS has 90 days to review it. In that time, we work with CMS and they work with states on clarifications, questions, things of that nature. So during that time is when we would have those conversations. It doesn't delay necessarily the amendment. So we're still proposing an October 6th deadline, understanding that there will be those conversations in the meantime. To your other question, yes, we will be putting a red line document for all of the waiver on our dedicated webpage. Like I said, I'm hoping we plan to have that out next week, and we will be putting out communication to stakeholders to let them know when that's available online.
Thank you. Our next question is coming from Kenyatta Martin. Kenyatta, are you able to ask your question? Okay, I'm going to go to the next person. We'll try to come back to you, Kenyatta. Our next person is Elias Ashikan, and I apologize if I've pronounced your name incorrectly. Elias, are you able to ask your question?
Okay. Good afternoon. My name is Elias Ashikun. My question is in respect of several individuals with eligibility issues in our agency. Some of them are with us, we are their repay, and some their legal guardians being their repay. This has been submitted to EDD, and yet we have not been able to have any response. If I can look at my on my list now, I have about 9 that are pending. So we don't really know what to do, who to contact in EDD.
Thank you for sharing that feedback with us. I'm not certain if you heard earlier in this discussion, I mentioned how the Developmental Disabilities Administration is working very closely with the Maryland Medicaid Administration, which is where the Eligibility Determination Division sits within the Maryland Medicaid Administration. We are working very closely with EDD on these challenges that you bring to our attention. And so the information that is coming up from our regional offices are all being shared with EDD for research and follow-up. I will, if you would not mind, please reaching out to the regional office to make certain that your cases, the ones that you have shared with us this afternoon, are flagged so that we can share them with EDD directly for follow-up. We would greatly appreciate it.
Thank you so much, Marlena. And I know that we only have just a minute or two left here, so I do know that if you have had your hand raised and you want to put your question in the question box, we will review all of the questions. So for those of you who didn't get your question answered or didn't have a chance to publicly state your question, please put it in the box. We will review those. Marlena, Deputy Secretary, do you want us to move on to the next slide for closure?
Yes, please, Dr. Smalls.
So this is Nova again. We are very excited about the Technology First 4-year anniversary. And we're excited to celebrate this on Maryland becoming a Technology First state. We will be having our event on Monday, August 18th. So stay tuned for more information about this exciting event. We will be sending out information in the next coming days or weeks.
Thanks, Dr. Smalls. And as you can see here, please stay tuned as we continue to have our bi-monthly community meetings. The next community meeting is scheduled for September 18th, and the one after that is scheduled for November 20th. We want to thank you all for joining us this afternoon. Thank you so much for the very helpful feedback and the questions. For those of you who raised your hands and we did not get an opportunity to call on you, please take this opportunity to put your question in the chat for our review, consideration, and follow-up. Thank you again, everyone, for joining us this afternoon. Have a great day.